Hi, I'm Nick the nurse. Today we're going to be talking about the phases of the therapeutic-nurse relationship. It's important to remember that there are how many phases of the nurse-patient relationship? Well, some books say 3, but there's really technically 4 phases of the nurse-patient relationship. First, we have the pre-orientation phase, followed by the orientation phase, then followed by the working phase, and then finally followed by the termination phase. So what we're going to be talking about in this particular video segment is the pre-orientation phase. Now there's 2 really big major aspects of the pre-orientation phase that are important to talk about and important to remember both for the nursing school exams and the NCLEX as well as in your nursing practice. First and most importantly, the pre-orientation phase is before you even see the patient. And for that reason, the big thing you need to watch out for is you need to know as much as you can about that particular patient before even going into their room for the next step, which is the orientation phase. You should review the client's medical record, their history of mental health problems, whether they've had any physiological problems, which can lead to other problems like somatic problems and stuff like that. So it's really important that you understand that concept. The other thing during the pre-orientation phase is for the nurse to explore any problems that they have with preconceived notions or judgments. Let's say that you have a patient, and this is hypothetical, I won't say what I believe, but let's say that you have a patient who just had an abortion, and she's having a very chronic depression with it, and she's suicidal. And let's say that you, as the nurse, are very adamantly pro-life and you oppose abortion in any circumstances. You as the nurse need to examine your feelings, your thought processes, and your beliefs before going in and dealing with this patient. Why? Well, it's important to understand that you can't be judgmental, and that's another big thing in mental health nursing, is that it's important that you can't judge your patients. Okay, we have to have a non-judgmental attitude because that fosters a positive nurse-patient relationship, right? So again, just a pre-orientation phase that are very important are examining our own personal beliefs and making sure that we put them aside so as not to judge the patient, and making sure that we find out as much as we can possibly about the patient by either looking in the patient's medical records or talking to other staff members who have had previous dealings with the patient. So best of luck on your nursing school exams and on the NCLEX, and we'll see you next time.